Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to talk about is hepatitis. If you're not aware of what hepatitis is, it's a condition of your liver where your liver gets inflamed, and that can be happening due to virus infection or due to excess consumption of alcohol or any other infection to your liver. So hepatitis in general is your liver, which is your organ right here, gets inflamed and doesn't work properly. So to understand this, we need to know what does actually liver performs. So liver is, I call it in simple, is your purifier. Basically, it cleans your blood of any waste products and pass it through your body in the form of bile. So your liver processes anything which is a waste product from your body, and it will convert it into bile and send it through your intestine outside your system through excretory system. Other major function of liver is it makes your cholesterol, the low density lipids. I have talked about it in cholesterol video, but another major function of liver is it makes cholesterol. It helps detoxify your system, basically balances your nutrients. It helps in fat digestion. Again, it digests your fats, whatever you're consuming. It's liver who has to digest it. Yes, it goes through your excretory, your digestive system, but liver is the one who processes it. It is the process. It is the place where your dead. So once your blood is has gone through your system and it's about its age is ending, your, your blood stem cells are always making new blood, but then the, the blood cells which have worked and has to die, they come into the liver or they kind of are clarified in the blood and converted into bilirubin and then excreted out again through bile. So bilirubin is another thing which liver processes. Another function is hormones, and it also helps in blood clotting factors as well. So liver has a lot of role, and liver is the first organ which is made in a newborn baby as well, because whenever it is consuming food from its mother, liver is the one which has to process. So that's the first major organ which is developed in a baby as well. So you can understand what liver and how important the liver is. So what happens during hepatitis? So as I explained, hepatitis is nothing but is an inflammation of your liver. Your liver gets inflamed, and it can be either due to virus, as I said before, or it can be due to cirrhosis, which is when you consume a lot of alcohol, your liver gets scarred, or maybe due to cancer. So hepatitis can be any of these regions. And what happens is basically your liver gets inflamed and hence it cannot function normal function. It cannot do its normal function, which is detoxifying and everything. As a result, you'll get all these side effects or all these symptoms. You will be fatigued. You will not be able to digest your food. You will start losing appetite. Hence, you will start losing weight. You will have joint pain. And the other major thing is jaundice. Now, jaundice is, as people are aware, your skin turns kind of yellow, your eyes turn yellow. This is because the bilirubin in your blood goes high. So remember, I told you your blood is clarified in the liver. So when the blood has or the blood cell has worked its journey and it's about to finish its journey, your liver it breaks it down and converts it into bilirubin. And that bilirubin goes in the form of bile and then it is excreted out. That's in normal liver. But when your liver is inflamed and it's not functioning properly, the blood cells break down and convert into bilirubin, but it's not the liver is not able to send it into bile and process it to excretory system. So what happens is basically that bilirubin is again circulated in back into your blood, and so in your blood, along with your blood, your bilirubin is also going up, 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 up. So as you can imagine, your blood is normally red, and then you're having this bilirubin which is actually dark yellow in color, and if it keeps increasing, it will go all throughout your body, and wherever you can see it very easily, which is your skin, your eye, it will turn yellow. So when your liver is not functioning properly, you will get during hepatitis, the other side effect is jaundice. Now, jaundice, there's another misconception with jaundice is that if you have jaundice, most probably you will have hepatitis due to viral or viral infection. That is true, but your jaundice can also be caused if your gallbladder or your bilirubin is not being produced properly, and that's not necessary due to a virus infection. So you need to know why why you're getting a jaundice or why your eyes are turning yellow. But when you have hepatitis due to a virus, most probably you will develop a jaundice or your yellowish of your uh, eyelids and your skin. So that happens when you have hepatitis. Next, I wanted to talk about, even though I told that hepatitis can be done by virus or by alcohol consumption or by cancer. Of course, you can bring down your alcohol consumption, and cancer is something which requires another round of therapy. But there are vaccines out there to get against the hepatitis viruses. And there are total five types of hepatitis virus that has labeled as A, B, C, D, E. A is the one which is spread through contaminated food and water, and that is especially when the person's feces and they have not washed their hand. It's a very bad way of unhygienic way this virus can be spread out, and you will have a hepatitis A. Others are due to blood contact or infected blood or any contaminated. E is also contaminated food and water. And so basically, you have to have vaccination, make sure you have a good food hygiene, and you're basically being safe out there and not getting in touch with people's body. Even if you do, based on your work or whatever reason it is, make sure you sanitize yourself as soon as possible. And please get vaccinated. There are vaccines available for A, B, and C. And if you take C, I think you're available for D as well. Um, and E is very rare, but I think there are also vaccines available. So with that, I just wanted to give a little bit awareness about hepatitis and what happens in your liver. Mostly what happens is it's not able to do its purifying work, which is the detoxifying work, and as a result, you'll get all the symptoms, and it is reversible except when your liver becomes super fatty, which is the cirrhosis. It might not be reversible. Then you might need a transplant, and that's a worst case scenario. But we are not talking about this. I'm talking about hepatitis and what to take care of it. Now, another misconception with hepatitis, or when people have jaundice, people start making their own weird diets. You can simply eat normal diet, just don't eat too fatty because liver cannot process it. You can eat actually turmeric or saffron. They are good for you because they are anti-inflammatory. So you can consume that. Less oily or less fatty, less red meat, something which you are not able to digest, you should not eat. Something easily digestible and nutritious. Fruits, veggies, all those are good. So if people say when you have jaundice, you should not eat that, you should not eat this, it's just assume that things which your liver will not be able to process. As a result, you will get this jaundice and stuff. So make sure you're aware of that. With that, I would like to close off this topic here, and I will see you on the next one.